Hi, everyone. I'm Nikos Vlachogiannis from the Young Investigator Group of EUSTAR. We are in Barcelona for EULAR, and I have with me Dr. Jelena Colic. Jelena, can you give us a bit more information from the EUSTAR cohort about the patients with anti-centromere positive systemic sclerosis? So, what are their disease manifestations and what are the risk factors for organ?
Thank you very much. A really insightful question. Since we all know that anti-centromere autoantibodies are one of the most common one, and it was thought they're protective against major organ involvements. However, there are emerging evidence in challenging this notion, and that's why we actually try to define the cohort which are more prone for some visceral involvement. And I would just highlight briefly what was our main results. So if you do have a patient with the older age disease onset, more than 50, we should screen that patient for PAH and heart involvement. If we do have the patients with telangiectasias, we should screen for pulmonary arterial hypertension as well. If we do have someone with the male gender and late capillary pattern, let's think about digital ulcers. And if we do have someone male gender and reduced forced vital capacity less than 80, we should think about interstitial lung disease. We know how the inflammation is really important part of pathogenesis, and we found that the altered inflammation is related with a higher risk of having heart and lung involvement. But also we defined, let's say, the protective factors. So the patients with preserved pulmonary functional tests, those with a limited subtype of disease, with a younger age disease onset, and without telangiectasias, they weren't at risk for getting the major organ involvement in our population of EUSTAR intracentromere positive cohort. And that cohort was accounting nearly 40%. So we should really think about that.
So thank you very much. And risk stratification is really important. Thank you for all this info. And I hope to see you in March in Athens, and you can give us a talk about this, hopefully.
Thank you very much, and see you in Athens.
Thank you. See you.